Good afternoon. I'm Angela Buchanan, a registered nurse and first vice president of the Ontario Nurses Association. ONA is Canada's largest nursing union, representing 68,000 registered nurses and healthcare professionals in Ontario. We also have 18,000 nursing student affiliates. I'm here to deliver a clear message to this government on behalf of our members. Nurses are united in support of a public delivery of surgeries and hospital services. ONA has significant foundational concerns regarding Bill 60. This bill is unnecessary and ill-advised. Bill 60 will deregulate what it means to be a nurse, will worsen patient care, and will see more private corporations profiting off of your healthcare. In our written submission, ONA lays out our concerns with regards to the private delivery of care, the deregulation of nursing, and the dire impacts this bill will have on the health human resources crisis that already exists in our hospitals. We also offer real solutions by improving the public delivery of care. Our healthcare system relies on nurses, but years of underfunding has created the retention and recruitment crisis that is now being used to justify privatization of our public healthcare under this bill. The real solution is to invest in properly funding and staffing our public healthcare system. We know Ontario has the worst RN to population ratio in Canada. According to the FAO's latest report on Ontario Health Sector Spending Plan Review, Ontario needs to hire at least 34,817 nurses by 2027-2028. Ontario has the lowest start wage for nurses in Canada, and the unconstitutional Bill 124 has certainly not helped. Now with Bill 60, the government is planning to establish a parallel privately delivered surgical system, which will undermine our public healthcare system even further. This bill should be scrapped. ONA has significant concerns that there is no clear requirement in this legislation to ensure staff are not recruited from public hospitals. There are no parameters around pay, benefits, access to collective bargaining for staff in these new profit-motivated clinics. We've already seen privately owned surgical clinics and nursing agencies pay double the wages offered in public hospitals. This draws burnt-out staff out of our public system and exacerbates the staffing issues already faced in our public hospitals. This dynamic is further compounded by wage suppression legislation like Bill 124, which applies only to publicly delivered healthcare settings and would exempt the privately owned facilities contemplated in this bill. As nurses and healthcare professionals, we also have serious concerns about equitable access to care. Privately owned clinics will be able to refuse to treat patients with complex needs, only taking the easiest, highest profit cases. For patients, this means you may be put to the back of the line, while those deemed healthy enough will be bumped to the front of the queue. For nurses working in public hospitals, this will mean an increase in patient acuity and more unmanageable workload. We also have serious concerns about fee-for-service and undue pressure on patients to purchase medically unnecessary so-called upgrades recommended in these private clinics. ONA recommends that facilities not be permitted to charge fees for uninsured services and instead offer the OHIP-insured services which have been deemed appropriate by the province. If these clinics are to operate, there must be proper oversight and accountability, which are both sorely lacking in this bill. The public must have confidence that the clinics are regulated by the Ministry of Health directly and that information gathered during the licensing be readily available for public scrutiny. Now I'll shift gears to the deeply troubling Schedule 2, which allows the government to amend the definitions of nursing to include individuals who are not licensed by the College of Nurses of Ontario. To grant the government the authority to circumvent this licensing and accountability structure is unprecedented and will have far-reaching consequences. There is nothing to prevent the government from imposing regulations passed behind closed doors to allow PSW with a certain level of experience to work as an RPN, or an RPN who has been accepted into the bridging program to work as an RN before receiving the proper education. The regulation of nurses and healthcare professionals by our professional colleges is a bulwark for patient safety and professional accountability in our healthcare system and should not be overridden. Again, this legislation is unnecessary and ill-advised. This bill weakens the oversight of private for-profit healthcare clinics and undermine the patient safety by watering down the roles of licensed medical professionals, including registered nurses, registered practical nurses, and nurse practitioners. ONA encourages the government to listen to the voices of frontline and listen to the healthcare professionals, not the corporate CEOs. Ontario has the capacity in our existing public hospital system to expand access to surgical care. ORs are sitting empty for up to 15 hours each day because they do not have the staff to increase surgical capacity. The obvious solution is to provide hospitals with the resources to extend operating hours in their ORs. We need to retain nurses and healthcare workers by improving their working conditions and showing them they are valued. There is no time to waste. Invest the resources that Ontarians desperately need and deserve in publicly funded, publicly delivered, and fully staffed healthcare system. Thank you.
Thank you very much.